of Defensive Medicine and said they could find no valid basis for concluding that it was any major influence on American medicine. Tom Baker, let me just finish. Tom Baker, who is a University of Pennsylvania professor who studied the section said that there was no basis for concluding that. And one of the reasons is that I think what Bob says I agree with in part, that there is a question of where you draw the line and when to do the tests. I mean, I agree with that. That if it's a 1 in a million shot, ordinarily, you should not have to do the test. Right. I say ordinarily, though, because there may be some things that are so dangerous that even a 1 in a million shot for a very benign procedure, you'd want to have. For example, people don't fly in airplanes when there's when SARS thing came out. Nobody went to China. They didn't want to get the risk. What's the point of exposing patients to needless risk? I know what you're saying. Right? You know, but we have to think about where healthcare is going right now. I mean, we have $2.5 trillion is being spent on healthcare. Right. We can't afford, the country cannot afford to do everything for every patient every time to rule out everything. It just does. The system doesn't work that way. We can't afford it. Cultural changes too, aren't we? You know what? I love this example. I remember once reading, it was in JAMA, one of the medical journals, and they said that we have become victims of our own success. And they were talking about the soldiers and the Civil War. A lot of them had arms shot off and legs. And then as medicine advanced and the physicians were able to repair or save an arm or a leg, now many soldiers were saying, you know what? My arm isn't as straight as it was before the surgery. So it's in lawsuits that was, started around that time, I guess, late 1800s, started to increase. So we become sort of like victims of our own success. Don't you think so, Mike? I mean, without I think one of the problems is we don't have all that great a healthcare system, in spite of what we are terming our successes. I agree on that. Fully I mean, there are countries, even Canada, which I know gets maligned sometimes, but people can get decent health care on a regular basis, and everyone is covered. And, we have a problem here with the system. And I think we're beginning to understand that. I agree fully. Our outcomes in terms of life expectancy, infant mortality are among the lowest of the developed nations. The system is not working, but we also have very expensive care, and malpractice is contributing to the expense of the healthcare system. And we have to cut costs. We can't do everything for everyone every time. The costs, though, I agree there are some costs connected with it, but I think that when you want to look at the costs, the greatest cost is the malpractice that occurs itself. The Institute of Medicine, the medical society is one of the most, I guess, authoritative organizations in all of medicine, has concluded that 98,000 people die each year in hospitals in the United States from medical negligence. Wait a second. That's very contested. A lot of these people who died died from slips and falls. They died from things that were not necessarily related to medical care. A lot of these people were terminal people. They had end-of-life illnesses, and so there were a lot of things that went into that. I agree. People have addressed that, and these statistics are very inflated. And there's always room for improvement. But we're talking about major inflation of the statistics. I agree that a lot of people die unnecessarily because of medical negligence, but it's far less than was in that survey.
Excuse us, folks. Attorney Koskoff's going to sue me here for.
I think he got too excited.
Never.
I hope we're still okay.
Can I just put something in, just objectively? Mike, you were talking about the Institute of Medicine report.
Yes.
As a matter of fact, I read that report a few times. By the way, it's sad because they always say, they give a range. They say from 48 to 96,000.
44 to 98.
But they always focus on that.
Let's say it's 44,000.
Yeah.
Okay.
Even one death. I understand.
And let's say that Bob's right. Some of them are slips and falls. Those are things often related to the quality of medical care.
Sure.
Patients aren't properly restrained. Patients aren't warned. There are not enough nurses available to assist patients in going to the bathroom and other needed procedures. Those are all things. Sometimes they are people who were terminal anyway, but they are entitled to decent medical, caring attendants. And so I agree that these are maybe inflated, and it may be 44,000, but the number of cases, but how many cases would you suspect are actually brought each year? Medical malpractice cases in the state of Connecticut. We got 3.5 million people in the state of Connecticut.
360, something like that, or no, more?
No, less.
Oh.
In the entire state of Connecticut, Bob, last year there were 272 malpractice cases brought. It's the least number of cases in 18 years. So when you talk about cost and you talk about crisis, there isn't any crisis. This is a blip on the screen of the United States healthcare system in terms of cost. A blip. And that includes everything, even including some of the claim defensive medicine that you might say is practiced.
But you know, aside from the cost itself, there's the fact that the system is not working. You're aware of Stoddard's study from the New England Journal a few years, where about 40% of patients had non-meritorious claims. These were patients where the lawyers were suing for the doctors for malpractice. 40% of them were not based on meritorious claims.
Okay,
now, wait a second. Wait. Let me say finish.
Sure, sure.
Of that group, 28% won settlements. They were awarded money, so that it doesn't work for them. Now, on the other hand, the group of people who did have meritorious claims, only 73% of those got awards. So it doesn't work for the people who have suffered injury from malpractice, and it doesn't work for the people who haven't suffered injury from malpractice. It doesn't work either way.
Okay, let me respond to that. First of all, I see what you're saying. I see what you're saying. You're saying that it doesn't filter out the good cases from the bad cases.
Exactly.
And I disagree with that. And I disagree with that because, first of all, you're talking in the New England Journal article about doctors, again, viewing the situation rather than juries looking at it. A jury will look at a case differently.
The two lead authors on that were
public health.
No, the two lead authors were lawyers.
I know, but lawyers aren't the ones who decide cases in this country, and doctors aren't the ones who decide cases. Jurors decide cases.
I'll say something about that. That's a good point, because one of the things that doctors and lawyers always fight about is that we're saying that juries are overwhelmed trying to digest the information that comes across because healthcare's gotten so complex.
You know, it hasn't been that. My experience in trying many cases, many malpractice cases, is that jurors get it. Jurors get it. And when you ask the judges who sit on the cases, the judges say the jurors get it. The jurors, I would have done almost excess of 90% of the time, the judges says I would have done the same thing.
Except,
and that's because, part of it is because, Bob, of this. When a New England Journal person or anybody, a doctor, looks at a case, what they're going to do is they are going to look at the medical record. And they're going to decide, based on the medical record, whether there was a deviation from the standard of care.
Right.
A jury looks at much more than the medical record. A jury looks at the statements of various witnesses. They look at what the plaintiff says he or she told the doctor that may not be in the record. And there's a lot of other factors that a jury will look at that will help to determine whether it was meritorious or it wasn't.
So you probably don't, and this is for both of you fellows, Phil Howard, big proponent of the so-called health courts, where they have special judges trained in malpractice issues. Do you think that would make this issue any more?
I think I would go further than just special judges. I think we do need judges who are trained in malpractice, but I think the initial evaluation of the cases should be by a physician panel to decide whether or not malpractice has occurred. Because I don't think I think in a large percentage of cases, a jury can't decide whether or not malpractice has occurred, because there's a lot of arcane areas. There are a lot of things that go on that it's very difficult to explain. Also, the juries are dependent on the testimony of expert witnesses on both sides. Now, there happens to be a litigation support industry here where people pick out the experts